Hello everyone, welcome to De-Roofing Dentistry. This is Dr. Kushali Arora and today we are going to start with part 2 of diagnosis and treatment planning. So if you have not yet watched the part 1, I would highly recommend doing so first as we discussed the fundamentals of diagnosis in part 1. Those concepts provide the foundation for today's discussion and will help you understand this lecture more effectively. So once you have reviewed part 1, you can continue with this lecture where we will focus on clinical history taking and the significance of various personal and medical factors in treatment planning for complete denture patients. Okay, so let's get started with today's lecture. So, clinical history taking is a systemic collection of information regarding the patient's personal details, chief complaints, medical status, dental status, and social background. A complete history assists the dentist in identifying the risk factors, recognizing systemic diseases, assessing prognosis, and formulating an appropriate treatment plan. Many important diagnostic clues can be obtained from history taking, even before the clinical examination begins. Clinical history taking starts with personal information like name. A name should be asked to enter in the records. When the patient is addressed by his name, it brings some confidence and psychological security. That name also gives an idea about the patient's family and community. So, apart from the identification and legal documentation, the patient's name helps to establish a personal relationship between the dentist and the patient. Addressing patients by their name creates better communication, greater trust, and improved patient cooperation. A positive dentist-patient relationship significantly improves the treatment acceptance and satisfaction. Then, after the name comes the occupation. Occupation provides a sight into socioeconomic status, lifestyle, functional requirements, and aesthetic expectations. Different occupations influence denture treatment in different ways. For example, teachers and public speakers. They have high aesthetic demands, excellent phonetics requirement, greater awareness of speech difficulties. Okay? Then then the manual laborers, they have greater masticatory demands and need durable prostheses. Then executives and sales representatives require more idealistic teeth, while other people who work in places with higher physical extortion require rugged teeth. And people with higher income have greater expectations. People who are very busy will be more critical about the comfort. So, occupation may also indicate exposure to stress and habits that affect the oral health. Then we have race. Race influences several physical characteristics relevant to prosthodontics. These includes facial morphology, skin tone, tooth form, arch shape, and facial profile. Understanding racial variations helps achieving better aesthetic harmony during tooth selection, shade selection, and denture characterization. The clinician should always individualize treatment and avoid rigid stereotyping. Then after the race, we have location. Location. So, the patient's place of residence provide useful information regarding dietary habits, accessibility to dental care, cultural practice, and follow-up possibilities. For example, rural patients They may present with delayed dental treatments, advanced ridge resorption, and limited access to regular care. While the urban patients may have greater aesthetic awareness, higher expectations, and better access to treatment facilities. Location also affects the feasibility of recall appointment and long-term maintenance. Okay? Also, some endemic disorders like fluorosis are confined to certain locations, and people from that locality may want characterization in their teeth for a natural appearance. Then after the location comes the religion and community. Religion and community may influence the dietary preferences, cultural belief, attitude towards health, and aesthetic expectations. Certain communities may have traditional beliefs regarding tooth extractions, denture wearing, and oral hygiene practice. So, we should respect the cultural diversity and provide treatment that aligns with the patient's belief whenever possible. Understanding cultural background helps improving the communication and patient's acceptance. And with this is all about the clinical history taking. Now we can move on to the medical history. Medical history is one of the most important components of diagnosis. Many systemic diseases directly affects the oral tissues, healing capacity, denture tolerance, and treatment prognosis. So, we must obtain the information regarding the current illness, previous illness, hospitalization, surgeries, medication, and allergies. A thorough medical history ensures safe and effective treatment. So, firstly, debilitating diseases. Debilitating diseases are chronic conditions that reduce patients' physical strength and functional capacities. Examples: tuberculosis, chronic renal failure, cancer, severe anemia, and chronic infections. Prosthodontic significance. These patients may exhibit poor tissue resistance, delayed healing, reduced neuromuscular control, and increased fatigue. So, we should consider short appointments for such patients, gentle clinical procedures, frequent rest periods, and close medical consultation when necessary. The all over prognosis may be affected by the severity of the disease. Okay? Then, the diseases of joint. Joint disorders are commonly encountered in elderly edentulous patients. Examples include osteoarthritis, rheumatoid arthritis, and temporomandibular joint disorders. Such patients may find it difficult to insert the denture, remove the denture, and in cleaning the denture. Temporomandibular joint involvement may cause pain, restricted mouth opening, and difficulty in recording jaw relation. So, the management of this is simplify denture hygiene instructions, use easy to handle prosthesis, and minimize stress on affected joints. Okay, after this, the cardiovascular diseases. So, the cardiovascular diseases are frequently encountered in geriatric patients. Common conditions includes hypertension, ischemic heart disease, angina, and congestive heart failure. The significance of cardiovascular diseases: reduced tolerance for long appointments, anxiety related complications, and increased risk during stressful procedures. We can manage this by obtaining detailed medical history, monitoring the patient's comfort, scheduling shorter morning appointments, and avoiding excess stress. Okay? Medical consultation may be required in severe cases. After the cardiovascular diseases, we have neurological disorders. Neurological disorders significantly influences the denture success. Examples include Parkinson's, stroke, multiple sclerosis, and Alzheimer's. These patients may present with impaired muscular control, leading to poor denture retention, difficulty in mastication, and difficulty in speech. Tremors may interfere with denture insertion and denture removal, while cognitive impairment may reduce the cooperation and ability to follow the instructions. We can manage such patients by simple treatment protocol, caregivers' involvement, frequent follow-up visits, and realistic expectations. Now, after the neurological disorders, we can move on to the oral malignancies. A history of oral cancer is extremely important during diagnosis. Patient may have undergone surgical resection, radiation therapy, or chemotherapy. Now, the prosthodontic significance of oral malignancies. Such patient may often present with the altered anatomy, scar formation, xerostomia, and tissue fragility. Radiation therapy may result in reduced salivary flow, increased mucosal sensitivity, and difficulty in wearing dentures. We can manage this by careful tissue evaluation, maximum tissue protection, regular follow-up examinations, and coordination with oncologists when required. So now we can move on to the last topic of this video, the climacteric conditions. Climatic conditions like menopause can cause glandular changes, osteoporosis, and psychiatric changes in the patient. These can influence treatment planning and the efficiency of the complete denture. So, such patients may complain of burning mouth sensation, xerostomia, altered taste sensation, and mucosal discomfort. Some individuals become highly conscious of oral symptoms despite of minimal clinical findings. These patients may demonstrate increased denture intolerance, mucosal sensitivity, and psychological stress. We can manage this by careful evaluation, reassurance, good denture fit, and regular follow-up. Understanding the hormonal and psychological influence is essential for successful treatment in such cases. So that is all about the today's lecture, and to conclude, a detailed clinical history is an indispensable component of diagnosis and treatment planning in complete denture prosthodontics. Information regarding patients' personal background, occupation, race, location, religion, and medical status provides valuable insight into the factors that may influence the treatment success. Particular attention must be paid to debilitating diseases, joint disorders, cardiovascular diseases, neurological disorders, oral malignancies, and climatic conditions, as these conditions may significantly affect prognosis, treatment procedures, and denture acceptance. A thorough history not only helps in identifying potential complications but also helps us to develop an individualized treatment plan that is safe, realistic, and patient centered. Thank you for watching my today's video, and if you liked my video, please do share and subscribe my channel. Thank you. Bye bye.